NHA CCMA practice questions. Question 1. A clinical medical assistant is preparing a patient for a 12-lead EKG. The patient is diaphoretic and the electrodes are not adhering properly. Which action should the assistant take? Use alcohol to clean the skin and allow it to air dry before placing electrodes. Apply talcum powder to reduce moisture. Skip leads that do not stick and proceed with the test. Reposition the patient to a seated position to reduce sweating. Alcohol effectively removes oils and moisture from the skin, enhancing electrode adhesion. Allowing it to air dry ensures proper conduction without interfering substances. Talcum powder interferes with electrode contact and should be avoided. Question 2. During a routine urinalysis, a clinical medical assistant observes that the specimen appears cloudy and has a strong ammonia odor. What is the most appropriate action? Discard the sample and ask for a new one. Continue with dipstick testing and document appearance. Refrigerate the sample and retest in an hour. Warm the sample and then test for protein. Cloudy urine with a strong ammonia odor often indicates infection or dehydration. Testing should continue as ordered, and the abnormal appearance must be documented for provider review. Discarding the sample without testing would delay diagnosis. Question 3. A provider instructs a CCMA to administer an intramuscular injection to a 6-month-old infant. Which site should the assistant choose? Ventrogluteal, dorsogluteal, deltoid, vastus lateralis. The vastus lateralis, thigh muscle, is the preferred site for IM injections in infants because it has a thick muscle mass and is free of major nerves and blood vessels. The dorsogluteal is avoided due to sciatic nerve risk, and the deltoid is too small in infants. Question 4. A clinical medical assistant is reviewing a patient's history and sees that the patient is allergic to latex. What should the assistant do before administering a blood draw? Proceed with standard gloves unless a rash appears. Confirm allergy and use nitrile gloves and latex-free supplies. Document allergy but use regular supplies for quick procedures. Ask the provider if the allergy is still active. Latex allergies can cause severe anaphylactic reactions. The assistant must use latex-free alternatives, nitrile gloves, latex-free tourniquet and bandages, to prevent exposure. Documenting and adjusting equipment are both critical safety steps. Question 5. A CCMA is obtaining a blood sample for lipid profile testing. Which instruction should be given to the patient prior to the test? Avoid dairy products 6 hours before the test. Consume a high-protein meal the night before. Fast for at least 12 hours prior to testing. Drink plenty of water 2 hours before the test. Fasting for 9 to 12 hours is essential for accurate lipid profile values, especially triglycerides, which are significantly affected by recent food intake. Water is typically allowed, but food must be avoided to prevent falsely elevated results. Question 6. A clinical medical assistant is preparing to record the pulse oximetry of a patient with cold fingers. What should the assistant do to ensure accurate readings? Place the probe on the index finger and wait longer. Warm the patient's hand and place probe on the earlobe. Use the probe on the foot regardless of temperature. Apply petroleum jelly to improve contact. Cold fingers cause vasoconstriction and poor circulation, leading to inaccurate pulse oximetry readings. Warming the hand improves perfusion, and the earlobe can be used as an alternative site if fingers remain problematic. Question 7. A patient who recently immigrated from another country presents with a persistent cough and night sweats. What should the CCMA do first? Notify the provider immediately. Ask the patient to wear a mask and isolate them. Record symptoms and wait for provider instructions. Provide cough syrup and reschedule. Night sweats and persistent cough may indicate tuberculosis, which requires airborne precautions. The patient should wear a mask and be isolated immediately to protect staff and other patients from potential exposure before provider evaluation. Question 8. During a capillary puncture procedure, blood flow is slow and clotting begins. Which action should the CCMA take next? Apply pressure and bandage the site. Squeeze the finger firmly to increase flow. Wipe away the first drop and warm the hand. Switch to venipuncture instead. Warming the hand dilates blood vessels and increases blood flow. Wiping away the first drop removes tissue fluid contamination that can alter test results. Excessive squeezing should be avoided as it causes hemolysis and tissue fluid mixing. Question 9. A CCMA receives a critical value for a potassium level of 6.8 milliequivalent/L while reviewing lab results. What is the appropriate next step? Schedule a follow-up appointment for next week. Immediately notify the provider. Ask the lab to repeat the test. Call the patient and inform them of the result. A potassium level of 6.8 is dangerously high, hyperkalemia, and can lead to life-threatening cardiac arrhythmias. Critical values must be reported to the provider immediately for urgent medical intervention. The patient should not be directly notified by the CCMA. Question 10. A CCMA is performing an EKG and notices artifact on the tracing due to somatic tremor. What is the appropriate intervention? Reclean the electrode sites with alcohol. Ensure the patient is not cold and is relaxed. Move the patient to a prone position. Tighten the EKG machine cables. Somatic tremors are caused by muscle movement, shivering, or patient anxiety. Ensuring the patient is warm, to prevent shivering, and calm, to reduce muscle tension, helps minimize this artifact. Recleaning electrodes addresses different types of artifact. Question 11. A clinical medical assistant is instructed to obtain a blood sample for a complete blood count, CBC. Which tube should be used? Light blue top, green top, lavender top, red top. The lavender top tube contains EDTA, an anticoagulant that preserves blood cell morphology for hematology analysis. Light blue is for coagulation studies, PT/INR, green contains heparin for chemistry tests, and red has no anticoagulant for serum tests. Question 12. When instructing a patient about a 24-hour urine collection, what is the correct protocol the CCMA should emphasize? Discard the first urine specimen, then collect all urine for 24 hours. Collect only the first and last samples within the 24-hour period. Keep the specimen in a warm environment. Drink only 8 ounces of water during collection. The first morning void is discarded to mark the start of the 24-hour collection period. All subsequent urine, including the first void the next morning, must be collected. Proper refrigeration is required, not warmth. Question 13. A CCMA is teaching a patient about wearing a Holter monitor. Which instruction is correct? Remove the device before taking a shower. Stop all physical activity during monitoring. Keep a diary of symptoms and activities. Adjust electrode placement if discomfort occurs. Patients must maintain a log of symptoms and activities during Holter monitoring to correlate events with ECG recordings. The monitor is waterproof for showering but not submersion. Electrode placement should not be adjusted by the patient. Question 14. When preparing a patient for a minor surgical procedure in the office, the CCMA should use which technique to maintain surgical asepsis? Touch sterile field only when gloved. Use alcohol-based hand sanitizer over gloves. Clean the site with soap and water. Wear a surgical mask only. Only sterile gloves may touch a sterile field to maintain asepsis. Any breach contaminates the field and requires replacement of supplies. Hand sanitizer over gloves does not achieve sterility, and soap and water is not sufficient for surgical antisepsis. Question 15. A clinical medical assistant is reviewing the EHR and notices a provider left a note that seems inaccurate. What is the proper course of action? Delete the entry and rewrite it. Contact the patient directly for clarification. Alert the provider discreetly for review. Edit the note and initial the correction. Only the provider who authored the note can amend their own documentation. The CCMA should discreetly notify the provider of the potential inaccuracy so they can review and correct the record if needed. Deleting or editing another provider's note is prohibited. Question 16. A CCMA measures a patient's blood pressure as 180 over 110 mmHg. What should the assistant do next? Wait 10 minutes and retake the BP. Notify the provider immediately. Instruct the patient to relax and return in 1 week. Document the reading and move to the next patient. A reading of 180/110 is a hypertensive crisis, which requires immediate provider attention to prevent stroke or cardiac events. The provider must evaluate the patient urgently. Delaying or rescheduling could be dangerous. Question 17. Which action should a CCMA take when labeling blood specimens in a hospital setting? Label each tube after leaving the patient's room. Label tubes in the presence of the patient immediately after collection. Use initials only for confidentiality. Allow the patient to label their own tubes. Specimens must be labeled immediately after collection in the presence of the patient to ensure accurate identification and prevent errors. Labeling away from the patient risks misidentification and specimen rejection by the lab. Question 18. A provider prescribes a 250 mg IM injection of medication. The available medication is 500 mg per milliliter. How much should the CCMA administer? 0.25 milliliters, 0.5 milliliters, 1 milliliter, 1.5 milliliters. To calculate desired dose, 250 mg divided by available concentration, 500 mg per milliliter, equals 0.5 milliliters. Always double-check calculations with another staff member when possible to prevent medication errors. Question 19. Which of the following best describes the proper method to clean an EKG machine after a patient with a suspected contagious skin infection? Use alcohol wipes on electrodes only. Disinfect with EPA-approved solution on contact surfaces. Rinse the wires in soap and water. Sterilize the entire machine. Contact surfaces of equipment must be disinfected using EPA-approved solutions to reduce the risk of cross-contamination. Alcohol wipes on electrodes alone is insufficient, and the entire machine does not require sterilization unless specified. Question 20. A CCMA is documenting a patient's chief complaint. Which entry is correct? The patient has been having stomach problems for weeks. Patient states she has had nausea for 3 days. Nausea for 72 hours and seems severe. States feels sick and probably has the flu. The chief complaint should reflect the patient's own words, typically introduced with patient states or patient reports. This maintains accuracy and preserves the patient's perspective in the medical record. Subjective interpretation should be avoided. Question 21. A patient with a hearing impairment is scheduled for an office visit. Which communication method should the CCMA use first? Use hand gestures exclusively. Speak slowly while facing the patient. Shout instructions clearly. Write instructions without verbal communication. Speaking slowly and clearly while facing the patient enhances lip reading and nonverbal cues, which supports effective communication. Shouting distorts speech and is not helpful. Written communication may be used as a supplement if needed. Question 22. Which of the following is a CLIA waived test that a CCMA may legally perform? Hematocrit manual testing. Cholesterol by venipuncture. Fecal occult blood test, FOBT. Peripheral blood smear. Fecal occult blood tests are CLIA waived and may be performed by trained medical assistants in clinical settings. Manual hematocrit, cholesterol by venipuncture, and peripheral blood smears require higher complexity certification and are not within basic CCMA scope. Question 23. A provider prescribes amoxicillin 500 mg POTID for 10 days. How many capsules will be dispensed in total? 20, 25, 30, 35. TID means 3 times daily. For 10 days, 3 capsules/day times 10 days equals 30 capsules. Always verify calculations carefully to prevent medication errors. The prescription should be checked against the patient's allergy history and other medications. Question 24. Which condition may result from repeated venipuncture on the same vein? Thrombosis. Polycythemia. Hypoxia. Hemoconcentration. Repeated punctures can damage the vein endothelium, leading to clot formation, thrombosis. This makes future access difficult and can cause complications such as pain, swelling, and reduced circulation. Alternative sites should be used when possible to preserve vein health. Question 25. A CCMA notices a coworker accessing the EHR of a patient they are not treating. What is the appropriate response? Report the incident to the supervisor. Ask the coworker for clarification. Ignore the behavior unless it repeats. Tell the patient what occurred. Unauthorized access of patient records is a HIPAA violation and must be reported to the appropriate supervisor or compliance officer. Patient privacy is legally protected, and failure to report known violations can result in penalties for both the individual and the facility.